In today's video, I want to give you a very simple and powerful 5 exercise disc herniation, disc bulge, and even post-fusion friendly hip mobility routine. That was a mouthful. But what you're gonna get is not a bunch of stupid stretches. We're gonna focus on very important, gentle hip mobility exercises that you can do, and also what you should be looking out for if you have a disc herniation, if you have a disc bulge, disc rupture like me, or if you have had some kind of spinal corrective surgery. If you want to dive deeper into my no stretch, no medication, no surgery approach to getting out of chronic persistent pain, go to fitnessforbackpain.com/pain-free training. It's a free guide. It's absolutely yours. I give you everything I know, everything I give to clients that are trying to use exercise smart, to get off the operating table, just to not go back towards the operating table and live free. Grab that at fitnessforbackpain.com/pain-free training. Now, before you get started, one of the most underrated tools or activities you can do before you actually start your back pain friendly mobility type of routine is to spend some time warming up. One of the best metrics or grades that you can give yourself on as far as whether you're warmed up enough is, did you break a sweat? Are you kind of perspiring, I guess you can say, after a bike ride or after a fast-paced walk or whatever you do to warm up? Or the other option is 2 core exercises before I even start. Sometimes I'll do the core work first. I'll pick 2 exercises, let's just say the front plank and the side plank, and I'll do each of those exercises, maybe 1 or 2 sets of each one. Then I'll get into my warm up in a sense of my fast-paced walk, or I'll do my fast-paced walk, warm up however I want to, then do these core exercises, then go into my hip mobility routine. Honestly, it just really kind of comes down to personal preference. My body just feels better with that kind of early bump in the core stability or core strength, that extra blood flow to the area. Just makes me feel better. That's why I use it, and I feel safer doing certain mobility drills. So once all that's out of the way, I'll then go into just a basic hip movement. So I'm gonna show you one of my favorites here. What I'll do is on my back, I'm gonna practice just some basic range of motion drills with my hips. So I can have one leg up like this, you can have them both on your flat down like this, whichever feels better for you. But essentially, I like to have my arms out for stability, and I'm gonna bring my leg in as high as I can without actually lifting anything, like my butt off the ground. Let it drop out, find that full range of motion at that hip socket, and bring it back around. And I'm gonna repeat this 8 to 12 times, going in and then dropping out. Then I'll go the reverse way. So dropping out, trying to allow my body weight to let that leg drop and use gravity and the weight of my leg to actually apply that downward stretch or that downward pressure on the leg without actually doing any extra pressing or allowing my hips to come off the ground. You don't want to be rotating during this. So allow your leg to come out, drag it up, keeping both butt cheeks on the ground, trying to relax that low back. We're trying to protect the area, not flinch or tense up or overprotect. We're really just kind of teasing our hips and our mind and our central nervous system, prepping the hips, prepping the area for what we are about to do. Once that's done and out of the way, the next thing I like to move into is a 90-90 hip stretch. Very common, very basic, but there's some cues that I want you to kind of think about and be mindful of, especially if you have a disc herniation, disc bulge, fusion, sensitive low back. Me personally, I ruptured my L5-S1 disc. It's all about body position and not pushing anything too far. So the 90-90 essentially is what I'm doing is I'm trying to take my front leg and create a 90-degree angle here. The same time with my back leg, I'm trying to have it pitched out, creating a 90 here, and then another 90 at my knee here. So once you're in position, you're really gonna kind of feel it deep in this right hip socket. You're gonna feel it on the inner thigh here. But more importantly, it's gonna be, or where your body is gonna determine how tight you are in this position. So if you find yourself trying to compensate and you're like trying to hold on for dear life to hold this position, grab a wall, grab a chair, grab something you can hold on to, prop yourself up, and try to maintain this chest up, ribs down, neutral position the best way possible. What I'm trying to do is not press into this super, super hard and get a deep, hard stretch from this. All I'm trying to do is get myself in this challenging position, recognize what's going on, making sure I don't feel any kind of tension on that low back or that low back area. And then I'm just gonna sit here and breathe. If you've gotten past the point where you're just standing here, what I want you to do is as square as possible. So I'm facing here, facing the camera. I'm gonna come down here, right? So you can come straight down and straight out like this. You can lean and turn a little bit to come challenge this area here. And you can do the same thing for here and come down towards your toes. I suggest or encourage you to explore those different areas. Just be mindful of the rotation at the low back. This is not if you can't do it, if you can't get this amazing range of motion, it's okay, it's okay. All we're trying to do is first get comfortable in this position here, and then if we want to take it further, we can take it further through here. So at the 90-90, I like to do the weighted hip leans. Now, essentially what we're doing here is we're gonna have one knee or one leg on one knee, and then we're just gonna take the other leg and take the toe and point it essentially in the same direction that the knee is pointing, okay? From here, grab a weight, don't go too heavy. This is not like a weight lifting type of exercise, but we're adding the weight so that we can kind of get some extra stretch as well as some resistance to kind of help us engage these muscles as we're kind of coming in and out of this position. So what you're gonna do is nice and comfortable, allow the weight to hang down, whatever feels comfortable, a kettlebell, dumbbell, whatever you have. And all I'm gonna do is I'm gonna shift my weight towards this leg here and that toe. So I'm just taking myself and shifting my weight here. So you're gonna feel this really heavily in the internal thigh here, as well as you're pressing into here, you'll feel it into the groin down here on that right leg or whatever lead leg you're using. What I suggest you do is not to just hang out in this position, as in come out here like this, get a good stretch and just kind of like melt. Because I like to actually focus on where my body is at in space, especially what's going on in my low back. So I'm making sure that I'm not protecting, I'm not over contracting the low back, getting that stretch. And I'll do that between 10 to 12 times, going in and out, not pushing too deep. Then I'll switch it here, allow that weight to fall down. It's just a resistance. I'm gonna push towards that big toe on the lead leg, get that stretch, control it coming out of it, watching those transitions, going down, getting that stretch, and then coming back with the weight. 10 to 12 reps each side, you should be good. All right, so the last exercise you're gonna do during this hip routine is just a basic bodyweight squat with knee drops, okay? So what I like to do is, you can do this a few different ways. One way is going nice and wide. So I'm essentially standing wider than what my normal squat stance would be, and I've got something to support myself, so I'm not trying to hold myself up. When I'm in this position, I'm gonna sit back, making sure I'm not in overextension, trying to do some kind of weird protection. I'm here, I can gently allow my core to brace, but essentially I'm just trying to relax and sit into this hip position or this squat position. What I'm not trying to do is really blow past any kind of protection or any kind of like really stiff or tight muscles just to get the extra stretch. I want you to go nice and slow, but also focus on relaxing that lower back while you have a gentle brace on. The second thing I want you to do is get into a little bit more of a narrow or a natural squat stance where you can actually get a little bit lower, find an ideal depth for you. And once you're here, try to relax, making sure your low back is not rounded over. I'm not compromising that low back. I'm trying to keep it at a depth that I can manage. And I'm gonna take my knees and I'm gonna kind of like freestyle a little bit, just move things around. I might shift my weight from right to left, pull it back, pull it forward, favor one calf like this, come over, or one ankle, favor one ankle over here. But essentially, I'm kind of dancing around and playing around in this stiff or end range of motion. That's it. Let me know which exercise you want to do. Now again, always take everything I say with a grain of salt. If you want to use one or two of these hip mobility exercises, please just do so. Don't feel like you have to do all of them to get benefit from them. You can do one, you can do two of them and actually get results. It's better to work up and go slow than to jump all in and just try to copycat someone else. Before you head off, make sure you go grab that pain-free training guide. You can get it at fitnessforbackpain.com/pain-free training. It is my no stretch, no drugs, no crazy yoga strategy towards using exercise, using movement to getting out of chronic pain. Grab that again at fitnessforbackpain.com/pain-free training, and I'll see you on the next episode.